Hey there, it's Dr. Alan Bauman from Bauman Medical Hair Transplant and Hair Loss Treatment Center. And wow, isn't the modern world amazing? Right from our phones, we can listen to music, watch movies, we can order lunch, get groceries delivered. And of course, you can find out a lot of information about hair loss and hair restoration. But is a Google search really the best place to go to get information about your medical condition, about hair loss, and the effectiveness of different treatments and procedures? Wow, the internet can be a landmine-filled place of misinformation, and it can really delay effective treatments. So one of the things that we have today is a virtual consultation where you can connect directly with me in a video conference call, and we can chat a lot about your hair loss situation, what you're trying to accomplish, and develop a plan. But is it worth it? What exactly happens during a virtual consultation with a board-certified hair restoration physician? And is it worth it to pay for this? Is it worth it to go forward with it? What are the things that we can accomplish during a virtual consult, and what things can't we accomplish? Stay tuned, we're going to cover all of this. So probably the best thing about a virtual consultation is that you can connect with me, a board-certified hair restoration physician, from anywhere in the world. You can get a preliminary evaluation, get your questions answered, and probably most importantly, no time is wasted. You can start therapy. And of course, as we say in hair loss, time is follicles. That means that hair loss is a chronic and progressive condition, and time wasted means hair lost. So what happens during a virtual consultation with a board-certified hair restoration physician? Well, I'm sure you can imagine a lot of information is exchanged. Obviously, I want to learn about your hair loss situation, what is going on, and of course, what you're trying to accomplish. We'll develop a preliminary treatment plan, and I'm sure you'll have a lot of questions for me to answer. So there are 4 basic parts of the consultation, right? Information about your hair loss status and risk factors. I want to learn about that. We'll talk a little bit about your goals, what you're trying to accomplish. We'll answer questions about therapies, the pros and cons of different treatments. We'll develop a results-oriented plan of action, and then hopefully execute, get you started on your journey. So once you've filled out the forms at baumanmedical.com and submitted the requested photos, my team will schedule a convenient time for us to connect. And the first thing we'll talk about is your hair loss status. What exactly is going on? What are you experiencing? Is it receding, thinning, shedding? Are you having a loss of volume or coverage? Is there breakage or poor hair quality? Are there any scalp health issues? Like, is your scalp irritated, dry, flaky, oily? We determine that in order to figure out, do we need to get our trichologists involved, our hair and scalp experts? Do you need a scalp analysis? And that can be hard to do, of course, over the internet. That might require an in-office visit. And then we'll talk about what are your current therapies or treatments. Have you had a PRP or a hair transplant in the past? Have you used medications or other things? And how did those work out for you or not? Then we're going to talk about risks. So your risks of hair loss. Obviously, hereditary risks are important because hair loss is primarily genetic. We'll discuss if there's hair loss in the family and the blood relatives. We'll talk about risk factors like medications, medical conditions, illnesses, lifestyle, nutrition, and more, including even shampooing and styling habits that could affect your hair and scalp health. Then we're going to talk about your goals. What are you trying to accomplish? Do you want to just maintain and enhance the hair that you have? Are you looking to restore a little bit or restore a lot? Then we'll develop a plan. So from all of this information, we'll develop a preliminary treatment plan that includes the key non-invasive therapies to protect the hair that you have. And we'll discuss, if needed, the amount and size of hair restoration procedures and other treatments you might be needed in order to reach your goal. So what can't we do? Obviously, if you need a specific scalp analysis, you can't do that virtually over the internet. We can't measure your hair in that way. We can't look at your scalp under the microscope. So do we need any of those things before proceeding? We'll talk about measurements for tracking and the need for scalp analysis if necessary. But if transplantation is needed, we can review the amount of grafts and sessions that are needed in order to develop a cost estimate for you. But all this will need to be confirmed with an in-office and in-person evaluation. And of course, that's going to be done well in advance of your procedure. It could be done weeks, days, or even hours before we begin. We'll review the lead time and resources that you need for scheduling a procedure like that, as well as your expected downtime. We'll review your concurrent regenerative therapies like laser therapy. Are you going to be doing PRP or PDO Grow or new treatments like exosome therapy in conjunction with a procedure or other treatments? Once we have that plan, man, then it's time to execute. So once your virtual consultation is complete, my patient advocate will reach out to you, send you the treatment plan summary, they'll contact you and help you execute any prescriptions or non-prescription products that you need for at-home use. They can discuss the timing, logistics, and costs of a procedure, payment options, and other details that you need to know. But probably the most important thing that we do during a virtual consultation is answer all the questions in great detail. So we'll set up realistic expectations of what the procedures and treatments can provide, and then we kick it into action. So if you think a virtual consultation is right for you, please visit baumanmedical.com and request one today. I look forward to helping you.